Hello and welcome to What's Your Why Wednesday. I'm Andrew Gofrek, ARMC's Chief Executive Officer, and this is a series that we're going to be producing to really look at connecting back to purpose, connecting back to the why, and meeting with different individuals throughout ARMC and understanding their why and how it connects to the work that they do. For today's conversation, I'm pleased to be joined by Jon Hall. Jon oversees our facilities department, which includes our project management, our environmental care, plant operations, and as well environmental services. Jon, welcome to What's Your Why Wednesday, and thank you very much for joining me today.
Thank you, Andrew. I appreciate being here.
So Jon, before we get into it, can you just tell me a little bit about how long you've been at Arrowhead Regional Medical Center, your role, kind of your day-to-day at ARMC?
Sure. I have been here about a little over 9 years. So February of 2017, I started at the hospital as a maintenance supervisor. I currently am the facilities operations manager. My role really on a day-to-day basis is to manage the environment that's kind of behind patient care. So everything that includes the physical environment, from regulatory compliance to a clean, safe environment for patients, to staff efficiencies, to facilities operations and maintenance, we handle on a day-to-day basis. We kind of directly impact the patients behind the scenes with infection prevention and cleanliness and our maintenance programs and our operationals.
You've got a lot on your shoulders. And I know I've had the opportunity to talk with you before, and I've heard your story, and it is truly impactful as to how you got into healthcare, how you got into Arrowhead, and really connecting back with patient care. Would you mind sharing kind of your journey into healthcare?
Shortly after the birth of my youngest daughter in 2012, I was a plumber by trade, had been a plumber for many years. At 6 weeks old, my daughter ended up with RSV. We had to take her to an emergency room late at night. In the ER, they immediately took her and performed life-saving measures, intubated her, was able to stabilize her and save her and transfer her down to a pediatric hospital, to a different facility than here, but to a pediatric hospital. And it was a total of a 2.5 week process. She was on life support, and just so many things happened during that experience, both good and bad, as part of her care and in experiencing it as a parent. She was downgraded multiple times against some advisement, ended up back on life support, almost being lost. She ended up with an infection while in the hospital. She ended up needing a blood transfusion. There was at times not great communication back to the parents, so I was pulled out of work, told to come to the hospital, that we were going to lose her, that I need to come save my goodbyes. 20 minutes later, she was okay. And so that just put us through an absolute roller coaster. Sure. But at the end of all of it, she had some great care. There were some great moments there with incredible people that had a lot of passion, and they saved her life. So I got to talk with other parents that weren't so lucky while I was there. And, it just kind of at that moment really hit me that I wanted my work and my career and my life to mean something more, to be able to serve other people and do the things that I witnessed happen with my daughter. So, being a plumber and by trade, it took me a few years to figure out how I can take my experience I already had and give it that purpose. Yeah. And so I went back to school in 2015, ended up coming here in 2017. And, that story still drives me to this day, to be able to serve and to be in that position that I witnessed so many people that were in when we were on the other side.
That's incredible to connect, your very, very personal experiences and really shift how you change your career path to align into helping others. And I know a lot of people can relate to that. And I really appreciate you sharing that story. I know it can't be easy. I know you also have another daughter, Kaylee, who is now a senior in high school. She was a volunteer with us for a little bit and now going into nursing. And how was your experience in going through that and getting into the hospital and getting into healthcare? How do you think that's also helped shape her and and the direction that she's going into healthcare?
I think my sense of purpose in my work, it doesn't matter how hard it gets or how tiring it gets. I have no desire to give up or to have an off day. It's as challenging as it's as satisfying as it is challenging, I can say. And I think she's seen that over these last many years I've been at the hospital, is that I enjoy my work, regardless of all the struggles that we may or may not go through on any given day. I enjoy what I do and I have a passion for it. And it's, I think she sees that sense of purpose and how rewarding, going into an industry such as healthcare, where you can serve your community and serve other people and see how you make other people's lives better, or give them an opportunity in a life they may not have had you not been involved. So I think she sees a lot of that, and she's a very purpose-driven person. So I think she relates a lot to, seeing my drive and my purpose, and just seeing how much joy and excitement it brings me really overall on a regular basis.
Well, that's fantastic. I know, we've been very privileged to have her volunteering with you and with the hospital. Hopefully she'll have an opportunity to come back after getting her degrees and be a nurse here at Arrowhead. The connecting back to that patient and to that family and that experience, I know is so powerful. And as you work through the facilities department or environment of care, how do you make sure that your teams really connect back to our mission and to making sure that our patients are always at the center of what we do? Maybe share a little bit about how you drive your own why into your teams to make sure that we're delivering for our patients.
There's a big focus, and I have a lot of meetings with my team where I talk about purpose and I talk about whys, and I share my story. And I share my story to help them understand, and really it's bridging that gap, especially in a support service, of how exactly do you impact the patient, because sometimes that gets lost in translation with a support service. They don't see the impact, or people don't see the impact they're making, and so it has a tendency to, the staff have a tendency to sometimes kind of lose that focus and that why, and so it's really connecting back to explaining, how our air systems help prevent infection and protect patients, how the cleanliness is part of infection prevention, how we are in charge of the safety of the hospital, and connecting that back directly to the patients and their families and what they're feeling. And so I share my story with them, and I connect dots regularly in meetings that we have to kind of instill in them that continuous drive and purpose, working behind the scenes.
I really appreciate it. You could just hear the passion as you speak, what you do. And I know the work that you do is just absolutely incredible, not just the work you personally, but your entire teams do. And it really comes across in living our mission. And I really appreciate your time today. I really appreciate your willingness to share your why with our community. Because as we drive Arrowhead Regional Medical Center as a hub for advanced medicine and medical education throughout our region, we're also very deeply rooted in our mission in serving our communities throughout the entire county. So, Jon, really appreciate your time today, and thank you very much.
Yes, thank you, Andrew. I was delighted to share, and hopefully this helps reconnect somebody else to their why.
I'd like to thank Jon Hall very much for sharing his why today on What's Your Why Wednesdays. We'll be having other members of the team ARMC throughout the year share their whys and connecting back to purpose. Thank you all very much for what you do each and every day for our patients and for our community. Have a great day.